Hi there, I'm Dr. Becky Pace. This is Tina Schaffner, Doctor of Physical Therapy, is coming from Neil King Physical Therapy. We're here with NKPT Reality Check, going to answer your top 10 questions from Google, coming to us to answer as professionals about neck pain. So we're going to chat. Why does my neck hurt all the time?
Oh my goodness, lots of reasons. Probably because you don't sit very well. So usually in almost every case, when there's a joint problem, your neck has lots of joints in it, you're probably not using that joint the way it's supposed to be used. And so in the case of neck pain, typically it's posturally related. It's how you're carrying something, it's how you're sitting, it's how you're carrying yourself.
So that answers part of it. Then next question, can my phone or computer cause neck pain?
Directly, no, but how you use that phone or computer, absolutely. So a lot of people like to blame their, I sit all day. Well, it's not that you sit, it's how you're sitting all day. It's how you use your phone. My phone, we talk about text neck. My kids will tell you all the time, I'll push their head back, because we can use our phone and we can look down or in my case, because of my vision, I have to put it out here these days. It's more so how we're sitting at our desk and how we're using our phone that comes into a problem.
And I think not to put it this way, but we just kind of get lazy, right? We kind of sit back. Yeah. Everything kind of goes forward. When this goes back, this comes forward. Yeah. The world is not always set up for us to be as posturally aware as we should be. So why do I get headaches from my neck?
We get headaches from our neck because there's so many muscles, primarily. I mean, there's lots of reasons to get headaches, but if they're coming from your neck, it's typically because there's lots of muscles in the back, the sides, the front of the neck that all feed up into the skull. And they have start and end points up there that pull on the skin of the bone, which is called periosteum. It's got a lot of innervation. And if you pull on that over time, it causes headaches and it can cause compression to that whole, what we call cranial vault. And that causes headaches.
Should I stretch or strengthen my neck?
Probably both. Usually when we have joint pain, it's a little bit of both. What I don't prefer is I do not prefer to see people doing this really heavy, cranking on their necks. We should not be stretching so hard that it's causing discomfort. Our neurologic system is actually built to protect against that, and your muscles will tighten up farther. So in many cases, we do need to do a little bit of stretching to the back, but we need to strengthen the front. We need to strengthen these muscles in the front, our longus coli, even some of our scalenes and things like that need to get stronger so we can keep the length and keep the looseness in our posture that we're seeking.
In addition to what you were saying, and I agree 100%, putting that extra tension through it, but sometimes overstretching it and also creating some tension into the nervous tissue. Sometimes that feels like a stretch and it's not, right? And so sometimes you might feel better for a second and then boom, those nerves come back, they kick you in the butt right after.
Right, your fingers shouldn't hurt when you're stretching your neck. That's a problem.
Right.
You might not want to do that
I'm
anymore.
feeling it all the way down. This feels so good.
That's
not great. We don't love it. Is it a pinched nerve, speaking of nerve?
So telltale sign of a pinched nerve, no matter where it is in your body, is you will typically get what's called radicular pain someplace else. So if you are getting numbness and tingling in some portion of your hand, your forearm, your upper arm, could be your legs if it's your back, or in between the shoulder blades is a huge one. And I will tell you, it can be some of that headache pain, especially if you've got pain that wraps around. If you're putting a lot of tension on that, those occipital nerves, that can all lead to different kinds of errors, but you'll get, radicular pain.
Yeah. Do I need imaging for my neck?
Not necessarily. So I am much quicker to request imaging in the case of a neck than I am even in a low back because of our spinal cords. Up in our neck, it is truly your spinal cord is running through your spinal cord, through the vertebral column there. In your low back, it's not so much. Your spinal cord proper ends at about L1-ish. So it's much less likely you're going to have other problems that are related to what's called central nervous system problems. So the only time I really recommend imaging quickly is if someone comes in with neck pain and they start to tell me, or I notice that they're having coordination problems or balance problems. That's a sign that you could be hitting the spinal cord, and that's a problem. We need to have a heads up about that. But in most cases, if they're just having, localized intrinsic neck pain, maybe some numbness and tingling, then not usually.
Can stress cause neck pain?
Absolutely. When we have stress, we try to put ourselves into this nice little ball. We try to make ourselves as small as we can, and that muscle tension up into the neck. There's a lot of, check an anatomy book out. There's a lot of structures up there that when they tighten up, they can cause pain.
And we don't think about all the other stuff that's connected through our fascial system,
right,
of what could be pulling and creating that imbalance that we see a lot of the times. Can physical therapy help headaches?
Absolutely. So one of the goals of physical therapy, we are the musculoskeletal specialists in the medical field, is we look at what muscles are tight or holding tension, what muscles might be short because they don't have enough flexibility, what muscles need to be strengthened. And a lot of times that goes back to postural stability and strengthening that posture over different movements, not just sitting in a chair, also bending over if you're picking something up, when you're pushing things up over your head, things like that. And so we're the movement specialists that can teach you how to use that whole body as a system to not put stress on any one area.
I get this question a lot, and I'm sure you do too. Why does my neck crack?
So neck cracking isn't necessarily a problem. The sound that you get, it could be small joint motion. So if you turn your head repeatedly, like I can turn my head back and forth and I get a little bit of a rub, grind. Arthritis starts over the age of 20. We all have it to some level. It could be that, just some roughened cartilage surfaces going past each other. But when you go and you get these people that are really cracking their necks and you get that big pop, those are cavitations. It is your joint expressing gases that have built up from not moving. And then when you move the joint really quickly, you get this, release. But that's typically that cracking noise. It's joints that haven't been moving that all of a sudden are moving.
And it's not always a bad thing.
It's not always a bad thing.
It's
not something that I seek, and it's not something that I necessarily look for. It doesn't tell me, ooh, I got a pop, therefore I got what I wanted. That's not true either.
Where we find problems with the mobility.
Yeah.
You might relate it to it, but not always. Sometimes it's where you get too much motion, right?
Yeah, absolutely.
When should I see a PT?
So what I usually say is with any physical issue whatsoever, you should seek a physical therapist if it's been a couple of days and your issues are not getting any better. Maybe you've tried some stretching that you've taught in the past. Maybe you have, come to our website and tried some of the recommendations that we put on our website and they're just not helping for you. That's when you can come to physical therapy. We do have direct access, partial direct access in the state of Michigan, so you can walk in off the street, we can make an appointment, and we can see you right then and there that day and hopefully address your issues early. But earlier intervention is always better than waiting.
Absolutely.
Yeah.
Tina, thank you for answering the top 10 questions asked. You've joined us for NKPT Reality Check. Thanks for coming. Hope you can subscribe and watch for more. We'd love to share more information with you. If you have more questions, feel free to reach out. We always offer free consultations. Feel free to subscribe, like our Facebook, like us on Instagram. We'd love to see more of what you want to hear about. Thanks and have a great day.
Thank you.